Hi, I'm Anne Bowditch, and today I have Tara Brehaut with me. And I'm just going to give you a little intro into Tara's background and what she's up to now. So Tara is currently a nurse working in the UK. She's actually Guernsey born and bred. Tara spent 10 years as a pharmacy technician, and she then actually travelled for 5 years, spending 2 of those in Canada. And Tara then went to university in her 30s to study nursing. Her placements included A&E, palliative care in a hospice, the gynae ward, which is many things gynecological, if that's the right way of putting it, community nursing, day surgery and theatres, so that's helping people in their recovery, and intensive care and to renal dialysis. So quite a broad range. And for someone like me who really knows so little about nursing, just to realize that you had to go through so much in terms of your placements, and I think maybe only the last 2 weren't placements, then that was quite, that was quite a list really. But I can completely get why you would have to do that. Because I imagine you need to gain the broad experience throughout all of those.
Yeah, it's a complete gamble though. You have to have, throughout the whole degree, 50% of your degree is theory and 50% is practical. But everyone's placements are different. So you could go through 3 years and have never gone in A&E. You could have never experienced intensive care. It's a complete gamble.
So I'm interested in if we move on to the nursing a little bit later, just to touch on your background. We spoke about travel, and you've travelled quite broadly actually. I mean, 5 years away from home is a long time. I know 2 of those years were in Canada, but yeah, those first 3 years, can you maybe give us a bit of insight into some of the places that you visited and anything that you notice and maybe experience or learn from those traveling experiences?
So I started off in Asia and spent a few months around Southeast Asia, Thailand, Cambodia, Vietnam, Indonesia, and I worked in Vietnam as well. I taught English there, and it was a bit surreal when I first got there. It kind of feels like a holiday, but the longer you're there, you sort of feel a bit rude because you see, a lot of groups of people coming in and just being disrespectful to the environment, and you can just see that Asia completely relies on tourism. And the longer you stay there, you just get a different perspective of the place. And I think because I worked there, it gave me an insight of, what they put up with really to survive. So I was in Asia for a little while, and then I went to New Zealand for a year and Australia for a year. And Australia kind of felt like a hot version of the UK really. I think you either love it or you hate it. And I didn't hate it, but I wouldn't want to live there. And I think a lot of British people do because of the weather and the environment and stuff. But I went to Canada after that, and I spent 2 years there, working and just being in the country. And I think Canada reminded me of home, but with a way better winter condition. Did a lot of skiing and outdoor stuff. But I think in the end, you just get a little bit sick of living out of a bag. I think it's different when you're in like New Zealand and Australia and Canada. I made a home because I was there for a while. But you do just get a bit sick of living out of a bag. And every country that you go to, you're kind of starting again. So like you're finding somewhere to live, finding a job, even simple things like finding something to eat. And I mean, everyone's in the same boat, and a lot of people help each other out, and they're friendly, and you meet some good people. But ultimately, I never really missed home, but I missed having a home. It was I don't know, it's a strange concept. And I think when I first started out, it was with a view to, you know, maybe live abroad, and I certainly could have lived in Canada. But the older I get, the more I think, actually, that's like halfway around the world, and you can't just be home in half an hour. And I don't know, it's strange. You always think you end up wanting to be a bit closer, and yeah.
Yeah, I mean, I know what you mean. I mean, I love my home, the comfort of home. Not so much that I need a lot of materialistic stuff, but just, you know, home is my safe place. Home is where I just feel completely relaxed, and you know, you can just kick off your shoes, and it just feels very comforting. So there's, you know, I did a bit of traveling with my cycling, but I got to the point where I just didn't want to do it anymore. I just wanted to be home. And I think part of that is having my cats, to be honest. I just want to be home with my cats. And I know that they miss me when I'm away. So I think that's a little bit of it. But you're, in many ways, you still see Guernsey as home, don't you? I mean, where you are now, you live in a lovely place, but Guernsey is home. But when were you last home, as in Guernsey?
2019. I had to work because I'm a nurse. You never get Christmas off. So I was home probably 2 weeks before Christmas 2019, and then obviously in the UK we were in lockdown. I think it was from March, so I couldn't get home all of last year just because of the way the rules work, and you have to isolate for 14 days, or I just haven't had the opportunity to have that amount of time off to get home. And now we're in 2021, so
yeah. And that must have quite an effect as well on your family, not having you at home as well, you know, for those what would normally be a week or couple of weeks.
Yeah, like I've just kind of got used to like working at Christmas time. Just kind of worked around that. But like last year there was loads of big birthdays. Like my dad was 65, auntie and uncle were both 60, my cousin was 21, and you just like, I think, you know, Easter time you were like, yeah, okay, it might last till the summer, and then it gets to summer, and then you're locked down again, and you just think it's a bit relentless. I tried to plan to come home, and then you just think, do you know what? Don't even think of a date. It's you want to have a bit of hope, but at the same time, I'm just being realistic. And then we're back in lockdown again. I mean, even you're in lockdown now, so
absolutely, yeah. I mean, I think that's it. It is about not planning. I mean, we had, I think last year we probably would have gone away and done a few kart races and that sort of thing, and maybe even a ski trip. And we've just said, let's not even bother thinking about travel now. You know, it's just, let's see where the next few years, because in my head I'm thinking this could be years, and I don't want that to sound dramatic, but I'm just trying to sort of, I find that having some sort of idea that, okay, let's get used to this in a way, because we don't know how long it's going to go on for. So I think sometimes it helps, like you say, not to plan and be disappointed constantly.
Yeah. I think to live with COVID is kind of what the reality is, rather than saying, oh, it's going to all be gone. I think actually we're just going to have to learn to adjust and live with COVID.
Yeah, that's it. And, you know, you have had your own experience of it, especially being a nurse. And although I don't want to necessarily make this chat all about COVID, because I think there's a lot of information out there, and actually there's a lot more to nursing than COVID. And I think that's the important thing in terms of understanding a little bit more about nursing. So you went to uni in your 30s, so you were a mature student. even though of course you still only look about 25, so I don't know how that works. But your first placement, I believe, was A&E.
Yeah, it wasn't my first placement. I think it was my second placement. But yeah, it was quite early on in my training, and at the time everyone said it should be a placement that's in your third year, so that you've got more clinical, the most amount of clinical skills that you could have. But a lot of the time it's kind of it's survival, and I don't know if that was my frame of mind. But before I went into nursing, I always wanted to be an A&E nurse. It was like, it just probably a lot of influence from the telly, but it was something that I thought I would really enjoy. And I think maybe having those expectations was maybe why I was so disappointed. But the lack of support was shocking. And I know I'm not the only person, but the thing is, you have to cover a broad range of placements, and obviously it's not suited to everybody. A lot of people have got a view of where they want to be when they qualify, and sometimes it completely changes, like it did for me. But some people will never change their mind. They'll just go in with a view to being, I don't know, a hospice nurse, and they'll end up being a hospice nurse because they won't even give anywhere else a shot. But I was quite open-minded about it. But I just, it was just, I never found my feet, and the lack of support and just not being able to tell people how I was feeling about it was probably that was kind of the crux of it, really. It did make me question even if I wanted to be a nurse a lot of the time. I did have a really traumatic experience, and for some people it's nothing, but I think probably to mention that it was on my first day, it would put it into perspective. To put it into context, I didn't even know where the toilet was, and it was in the afternoon, and they said, we're getting a cardiac arrest in. It was a woman. She'd been found in, I think she was an open water swimmer. She was with her friend, and she came in, and we had to do CPR on her, and she came in, and I was just shocked. It's fight or flight, isn't it? And I just completely froze. And there was me and another student, and what should have happened is that I should have been spoken through it and talked through it. This is what's happening. This is why it's happening. But actually, they just threw us in. So it's minute cycles to do CPR. And I was the third person on, and they're like, just go. And, they tell you if you need to go faster, if you need to go deeper for the compressions. And I thought it was so surreal. And I couldn't even picture myself doing that, let alone being involved in it. And then they said, look, you can't do it. You're not good enough. Like, next person. And it's like, everyone's around the bed and everyone's doing CPR. And I just remember thinking, this is insane. And I know that's what nursing is, but I couldn't process it in my mind. And I just was like, this is incredible. And I think the worst thing is, whenever somebody comes into A&E and they decide if they're going to continue treatment or they're not, there's a protocol that they have to go through, which I didn't even know, and I probably should have researched that beforehand. But basically, they go through a process of elimination of what it could be, and that's how they decide if they're going to continue or not. So this woman, I think she'd had CPR for half an hour before we came in, and we worked on her. It was probably 10 minutes, but it felt like about an hour. And they decided, if everyone agrees, we're going to stop. And I was doing compressions at the time, so I just assumed, okay, I'm going to stop. And they said, oh, so you agree? You want to and I thought, I don't know. I just, and then I stopped, and then I just completely broke down, because I thought, I can't even process what's happening. And I just was like, that's it, I'm out. So they, they take you out and they give you a cup of tea and have a biscuit, and then they said, oh, we'll talk through it. This is what's happened, this is why it happened, have you got any questions? And I thought, I've got about a million. but at the moment, I just want to go home. I don't even want to be in here. Like, I just need to get out. And it was, I know, I get it. It's a normal, it's an everyday thing. And that's what A&E is. It's an accident. It's an emergency department. And that is the kind of thing that you're going to have to deal with. But I just wasn't ready for it. And I don't think, I can still picture that woman now. And I just think I don't know, you either deal with it or you don't. And I obviously didn't deal with it very well. But there wasn't anybody to talk to, because it was my first day. I didn't really know anybody. I'd been assigned a mentor, but he was not the best. We didn't click. He didn't really want a student, and it just went on from there, really. And to the point where I nearly failed the placement, because I couldn't go back into resus. I was so traumatized. And it took me, the placement was 12 weeks, and I think it took me about 10 weeks to even tell anybody why I was struggling so much. And I just thought, what the hell? Like, I just thought in my head, if I can't even deal with that, then I can't be an A&E nurse, and therefore I can't be a nurse. And it just spiraled from there. I just really lost my confidence. I didn't want to do nursing anymore, and I just thought, I've had enough. It's not for me, and I don't want to do it anymore. And yeah, that was.
I mean, it sounds to me like you shouldn't have been in that place at that point in your training. Like you say, A&E is something that happens usually much later in training, because everyone's got to feel their way into any job, let alone a job which is based on life and death at times. So yeah, I mean, I don't know how you carried on through that, because I think a lot of people wouldn't have been able to, but you're absolutely right. That was a trauma then that happens right at the early stages of your placements. So, like you say, you've done a certain amount of, a fair bit of your theory or most of your theory, but at the point of this is early, full on practical stuff. So just, the wrong way around, definitely, by the sounds of it. So how do you get yourself through that and keep going?
Well, I think it must have been towards the end of the year, because I remember having that summer off, and I was just trying to be open-minded about it. And I thought, okay, just, take some time out, just, decide what you want to do. And I was doing a lot of research into, like how, particularly nursing, and how people deal with trauma, and like just talking to people about what they do to separate work and home and anxiety and all that, all that kind of stuff. And then I remember finding your page, and think just I'd never been hypnotized before, but I thought, what have I got to lose? I either try and tackle this and try and get a different perspective from it, and then just go on from there. But I think learning to admit that you are anxious about your job, and that there are things that you can't cope with, it makes you realize you're not superhuman. And I think that's one of the biggest problems with nursing, is that patients just see you as somebody that knows everything. Oh, you're a nurse, so you must know what to do, you must know how to fix me, and that's it. They don't actually think, oh, do you know what, you don't know everything. And even when you talk to senior nurses, and that's one of the first things they say to you, they're like, nobody knows everything, you can't be afraid to ask questions. And especially as a student, you should never feel that that you can't ask. And I think maybe because of my age as well, people, you just put so much pressure on yourself to achieve the best that you can. And I think even when I was being hypnotized, I still remember it. And you take me back into the room, and you're like, what would you tell yourself? And I just thought, my God, that's such a different perspective of how to deal with it. And I still do it now. I look back on things and I think, what would you tell yourself now? Like the decisions that you've made, and And I just think it's such a good way of looking at it, because, you know, even like the top clinical doctors can make a mistake. You're only human. And I think when you talk about the fact that you can't cope with something, it almost gives people a different perspective on you, and they think, do you know what, they've admitted that they're struggling, so let's do something about it. Let's not, you know, let's not just leave you to struggle. But yeah, that the hypnotherapy, and even the tapping and learning how to deal with anxiety, and it's made a massive difference, because I qualified as a nurse. So
you did it.
yeah.
Did it. Yeah, it's good hearing you talking as well about the tapping, which is on my YouTube channel. I've got a number of tapping videos on there, and in fact I intend to be adding to those. But actually what's great about the tapping, so what it briefly does is it's just tapping on what we call sort of meridian lines, which are basically very similar to what we would use in acupuncture, but we just use fingertips. And then that helps to release emotion and trauma, and anything that we don't want to be feeling. It's great for pain and all sorts of things. And you just focus on the issue, and you might sort of focus on an emotion or whatever, and it can help to release. And what I love about it is you can also use it for yourself. It's not something that you purely have to rely on a therapist to do. It's great to have a therapist there to help you with the more tricky stuff, and obviously it's down to the individual how far they take it. But you know, I give my clients a very simple technique which I call 3 words tapping, and you just there is a point called the karate chop point, but we miss that out on the 3 words. And I just have 3 words that you focus on, that you might sort of need in a way. So in your situation, it might be calm, it could be believe, as in believe in yourself, and even relax or breathe. Sometimes I include breathe, because it's just a reminder, breathe, because when we're stressed we tend not to breathe, you know, not very well anyway. So you would just go down to the point, so calm, believe, breathe, calm, believe, breathe. And you can also do what I call sneaky tapping, which is just tapping on the finger point. So you could do that anywhere, no one needs to know that you're doing it. And again, you can just silently say the words in your mind, or you can imagine tapping on the points, because again, it's all about energy. So it's about finding what works well for you. But you know, you get up in the morning and you do a few rounds, and you've made a good start to your day then. So
Yeah.
and those words almost become your mantras as well. So that's a really sort of easy one to use. So I think it's interesting, because it almost sounds to me, in terms of a practical solution, is, you know, there are improvements that could be made so that you didn't have to go through that. You know, in theory, you shouldn't have had to go through that. It's not to say you shouldn't have to deal with that at some point in your training or career, but there's a time thing here where really you shouldn't have had to deal with it when you did. Definitely, you should have felt confident enough to do that, and if you weren't, then you shouldn't have been put under that pressure at that time to do it, or dropped in the deep end. Definitely. So that for you was like a really, obviously it sort of was central, but then you also gained some other great experiences. The hospice, I mean, that sounded like a much more, for you, positive experience, where you're doing the palliative care. Tell us a little bit about that.
When I first found out I was going to the hospice, most people were like, oh God, doom and gloom, like you basically go in there and people are going to die and all this kind of stuff. But again, I was open-minded about it. And I actually really enjoyed it. It was probably one of my favorite placements, because, well, first of all, I got a lot of time with people, and I learned quite quickly it's not just a place that people go to die. A lot of people go there for respite, people that have like motor neuron disease that are being cared for at home. You know, they come to the hospice for a week or two. But it was really it was such a good opportunity to talk to people that are dying, and in some respects it's an awful thing to say, but for them, they knew that they were going to die, and it was almost lucky for them, because they thought, you know what, I've got this time and this is what I'm going to do. Where, you know, some people just drop down dead the next day and they have, you know, no idea but what to plan and all this kind of stuff. But there was a lady, she was probably, I think she was in her 40s, kind of late 40s, and she had cancer and she had a young family. And I just remember thinking, I couldn't believe how positive she was about the fact that she was dying. And she, you know, she wanted to make all these plans. She was going to donate her body to medical science so that they could, you know, do research and stuff like that. And I thought, my God, that's such an incredible thing. But even just, you know, just talking to people that, you know, they've been given this time limit on their life, and I just loved talking to people about what they've done in their life and why they've done it. And it really makes you think. You just have to make the most of every day. And I know it's such an ironic thing to say, because everyone's like, oh yeah, make the most of every day. But I think it definitely changed my perspective on life, really, because I had that opportunity to talk about mainly why people have done things in their life, and, you know, what they would do differently. And I think just being so positive about it, and almost, you know, having a laugh with them every day, rather than it just being a place that's doom and gloom. You know, they've well, not always, but people choose to go to a hospice, and it's such a nice environment. It's really calm. There's gardens around it, and it's, you know, I mean, the area I live in is lovely anyway. But you just wanted to give people the most of their time. There was a woman that when I first started my placement, she was there, and I think a couple of days before I finished, that was when she died. I got to know her for 3 months, and it was almost a privilege. And that's another ironic thing, you know, it was a privilege to be with you when you died. But I did feel quite lucky that I'd had that time with her. And she, you know, she's like, you know, make the most of what you're doing. Like, I changed my career in my 30s, and she was like, a lot of people wouldn't do that. And I think a lot of people wouldn't be as honest as I was. And I would just question people all the time, like, how have you got to this point? What would you do differently? Why, you know, why do you live here? Why do you do this? And it worked both ways. You know, people would ask me how I ended up where I've ended up, and I talk about my travels. But it was such a strange, strange concept, I guess, to nursing, that you're not trying to save someone, you're helping someone die. And it just gave me such a different perspective on life, and I really loved the whole placement.
So it's almost like you're helping them to have the most sort of comfortable and, I suppose, respectful sort of last however long of their life that they're there for, really. And it sounds also like you have, quite a bit like me maybe, a bit of a natural curiosity about people, which, yeah, I think that's great, because I think it can help you learn as a person and grow as a person and understand people better, which, you know, certainly my role as a therapist is important, I believe, because it makes me a lot less judgmental. And I imagine for you too, because nurses, you rarely are aware of any nurses being judgmental, whether they feel it a bit at certain points. I'm sure they do, because it's a human thing. But I imagine that also had quite an impact on how you sort of maybe see other people.
Yeah, and that is the thing, you try not to judge, but I mean, it's human too, isn't it? But yeah. Throughout all of my nursing, and probably just as much as a student as now as a qualified nurse, I've really learned to not judge people, and, you know, kind of think, how have they got into this situation? And you can't, I think, because I don't judge and I think about it from their point of view, it really helps to understand how people have got to that point. So even things like non-compliant patients, like giving you this medication for your blood pressure and you've chosen not to take it, and so now you've had a stroke. Well, some people would say, your own fault, bully for you, I'm not going to help you. But why don't they want to take the medication? You know, don't want to take meds for the rest of their lives, and they think, well, you know, I'm just going to carry on anyway. I've been all right so far. And it's just, and it's education. Sometimes people, you know, they haven't had the opportunity to ask the questions and understand why they've been given medication. And it's the most interesting job, I think, definitely.
Okay, so I mean, you spent some time in the gynae ward as well, and again, I think you said that also for you was a bit of a learning experience.
Yeah. So the gynae ward, as a student and as a qualified nurse, is the only place that you can refuse to work, because they perform abortions on the ward. And it's something that I'd never even thought about. And I thought, okay, it's my placement, that's it. And they even, you know, they ask you all the time, you sure you want to be here? Is it someone that have you even thought about it? And I think because I hadn't thought about it, I just went, and you know, that was it. This is my placement. And I think because I hadn't thought about it, when you know, when it came to the abortion clinic, I didn't even, I don't want to say it didn't affect me, but I wasn't as emotional as I thought I would be. It was, you know, it's shocking, but for some people, it's not a choice. And I didn't judge people, and I didn't think about it from my point of view. It's their choice, and we aren't here to judge. But it did make me think, you know, what they've been through and how they've got to that point. And even if it was their choice, that, you know, we might go to discharge the patient, and they've regretted their choice, and you have to deal with that as well. I think what I learned the most from the placement was how to deal with people mentally rather than physically, because it's probably one of the biggest choices that anybody's ever going to make. And sometimes it isn't a choice, it's, you know, something's gone wrong for medical reasons, but it is quite a judgmental place. And you know, everyone talks about it, oh, they're here again, or they're here again. And yeah, okay, I get it. It's, you know, for some people it is the easiest choice, and they think, yeah, don't want it, just, you know, that's it, it's gone. But it is, again, it's a strange concept. And you know, I don't have children, but I can't imagine having to make that decision and then be judged by people as well.
That's true, yeah. You talk a little bit there about sort of dealing with, you know, the patient's emotions. Is that something that you get a great deal of training in, or is it more something that comes more naturally?
I think that's probably one of my biggest gripes about nursing, is that you get very little training on emotional and mental well-being for yourself and for the patients. I think it's just something that you either do yourself or you just talk to people. And you know, they always say it's good to talk and you have to talk to people, but nobody does. And it's not until usually it's not till you get to a crisis point that people will talk about it. You know, you talk about leaving the course or you break down at work, and that's just how it happens, really. But I did for my own research, really, and for my own peace of mind, I guess, I did a lot of work on kind of mental health. And I think because I was so anxious all the time, I either had to learn to deal with it or find something else to do other than, you know, being a nurse. And it's not until you start talking about anxiety and finding it difficult to deal with things in the workplace that actually you realize the amount of people that are struggling and they don't talk about it. And I think that's probably one of the saddest things, that it's so short-staffed and you're so busy that, okay, you're there for the patient, but actually, if you're not in the best frame of mind, then you shouldn't be there. And that's probably a really hard thing to admit. And a lot of people just, you know, put this persona on. And I think that's why in my workplace, I get on with people so well, because how I feel is shown on my face. I don't hide anything. I'm honest. If I'm struggling, then I'm just going to say, I can't do it. And I'm going to need some help. And sometimes, you know, I put a lot of pressure on myself, and I think having to ask for help is really hard. But at the end of the day, you're dealing with somebody's life. And if you don't know what you're doing, I'm not going to blag it. Some people do, and, you know, they can, so they, you know, that's how they deal with it. But I'm just honest, and I'm like, I've not got a clue, you know, can you give me a hand?
I think I'd rather you do that than, like you say, blag it, really, when you think about it. But do you think then even though those early experiences were so traumatic and stressful for you, do you think they've helped you gain this attitude of, right, well, I'm just going to speak up?
Yeah, absolutely. And I think even going back to the A&E placement, there was two students, and we both went through exactly the same experience, and it affected her completely differently. And it didn't really affect her, to be honest. She dealt with it, and that was it. And I think, you know, even when we were back at uni and they said, you know, how's everyone's placements? And I was like, I did CPR on my first day, and the lecturers are like, oh yeah, you know, that's expected. And some people were like, oh my God, I just couldn't deal with it. And it just, you find a way of dealing with things, or you don't. And I think that happens life over. But had I not had all these experiences, good and bad, it wouldn't have made me see things differently, and, you know, be so open-minded, and, you know, be hypnotized. And it's definitely, it's changed the way that I do live my life, because I deal with people's lives every day. And even, you know, on a small or a big level, it definitely changes the way that I live my life, 100%.
It's like we always say, the person who's doing the caring has to be in a good place to be able to do the caring. But very many aren't, but in reality, to do that really well, because I think, you know, some people will do that caring, whether it's a nurse or whatever it is, and then go home and more or less collapse, you know, just then be a wreck. It's amazing what you can do when you're either on adrenaline or you just get yourself in a different zone. But actually, you know, you can do that, but then, like I say, you go home and it all just feels like it falls apart. And then you get the next day and you do it all again. And I imagine there's a hell of a lot of people out there, whether it's nursing or whether it's just, you know, anybody, especially at the current time with everything that people are going through. I imagine there's a lot of people that are somehow functioning, but also there's another part of them that is just struggling so much as well.
Yeah.
And that's why we have to do everything that we can for our own well-being. So what do you do for your own well-being? How do you look after yourself, other than, as you say, some of the sort of emotional and mental techniques that you've used? How else do you make sure that you're in a good place?
The outdoors is a massive thing for me. Like, I love hiking and walking and just being outside. Like, I'm lucky where I live that I've got mountains and everything all around me. But I think, I mean, even though it's a popular thing, you can go somewhere and not see another person and I just love it. I've got a little kit, and I just put it all in my bag and drive off and just sit and just listen to nothing. I really, really love it. It's like, it gives you a sense of achievement if you climb a mountain, and, even, boiling a kettle on a little stove and something, and just being in a completely different environment, no four walls around you. And that's definitely my biggest survival, being in the outdoors.
Yeah, absolutely. And I imagine with what you do in your work, just like you say, sometimes actually getting away from people is a really good thing, because when you are sort of helping people constantly, again, I know this from my work and I love my work, but it does take it out of you. And then you need that time on your own to almost like recharge.
Yeah, absolutely. Because I mean, my job now compared to my old job, the stress is virtually nothing. But I make an effort to go out because my patients can't.
So tell us a little bit about this. You're in renal dialysis now, aren't you? What's that like?
It's probably a complete I don't want to say career change, but my old job was in intensive care, and now I'm working in dialysis, and it's completely different. The day is planned, there's structure to the day. It's the same amount of patients, you see the same patients all the time. So they're in different levels of kidney failure, but they need to be put on a dialysis machine basically to do the job that your kidneys do. Theirs don't work anymore. 90% of the patients come 3 times a week for 4 hours. And that's basically their life. From last year when we locked down, I think probably a few weeks before that, they got the letter from the government to shield. So for the majority of people, they haven't been outside that whole time. I think they might have gone out a little bit in summer, but they just come from their home to the hospital to be dialyzed, and then they go back home again. And I couldn't, you can tell there isn't a lot to talk about. You talk about the telly, or you talk about what you've cooked, or nobody's been anywhere, nobody's doing anything. Like, thank God for Netflix. I just like, I can't even imagine. But I get a lot of time with my patients. I see them, I see them 3 times a week, 2 or 3 times a week. And I can get to know them. I can, talk to them about how they deal with having a chronic condition. I learn a little bit about the machinery. But physically, the physical part of the job is actually quite a small part of the job. It's more about looking after the patient's mental health. I've seen it happen a couple of times. I've only been there since October last year, and I've seen it happen a couple of times where a patient just won't turn up for dialysis, and you're like, what's going on? And they're like, I just had enough. I just can't be bothered. And I think I completely get that. And I think, again, just by being honest with them, and I think, how do you deal with that? And there's a couple of patients that are quite anxious about coming in and, being stuck on a machine for the rest of their lives, and it's a hard concept for them to deal with. And one of the nurses put quite a good spin on it, and she's like, don't think of it as a bad place, think of it as a good place. The machine's keeping you alive, make it your friend, and try and see it from a different point of view. And it is about looking at things from a different angle, and how can we get around this? And some people, there's 2 patients that have had a transplant, which has been successful so far. But it's a long-term condition. It's a chronic condition. There isn't a cure for it apart from a transplant. And I love it. I absolutely love it. And I think that's definitely changed. Well, it's a life changer to love your job and to go in, not mind doing extras, to be able to have a day that's got routine is completely against the norm for a nurse. Even on a ward environment, stuff happens all the time. And, I'm not saying there isn't the odd surprise, and, You know, sometimes a patient will be poorly and we'll have to take them off the machine early, or we'll get a patient in that we've got to fit in. And but it's just such a nice job. It's, you know, the stress is very small, and it's quite funny sometimes seeing how stressed the nurses get. And I'm like, you have no idea. Just work in ITU for 6 months and you will absolutely love coming here. Yeah, it's brilliant. It's a really good job.
It's great that you've managed to find your niche in your work, and in many ways at an early-ish stage in doing nursing, you know, even though you've done loads because of all the placements, you know, in many ways it's still, you know, it's not something you've been doing for many years, is it? So one thing with the ward that you're in, so with the renal side of things, you mentioned the shielding, and, you know, just putting that into perspective, like you say, these people can't go even to the shop. I'm assuming someone has to do that for them because of their vulnerability. And if I gather that if I think you've had the occasional patient with COVID, so you've had to full PPE and they're in a separate room. Now I've seen a picture of you in your PPE, and I know we've seen various pictures of, you know, nurses and so on, and you look at sort of them, particularly once they've taken the mask off, and you can see the marks all over their faces, some of them bruised, and your PP literally just drowns you out. I mean, you know, it's you know, on one level it's a little bit humorous, but on another level it's like, how do you even work in a day with that on? It must just be like just horrendous. I mean, can you get used to that?
I don't think you ever do. I think it happens so quickly that you just dealt with it. You know, you put the masks on, you put all this stuff on, and you just think, frickin' hell, like you just, you know, you get through it. I think it's much worse for the patients, because from a point of view where, I mean, even now at work we have to wear surgical masks all the time. Obviously with a COVID patient you're in full PPE. But I was on intensive care and we were dealing with patients that we were waking up, and that's what they were waking up to. And I just thought that must be absolutely terrifying. I know that some hospitals, you know, they take a picture of themselves and they put it, you know, they put it on their gowns or whatever. But I just think you can go through. I think there was a couple of patients that we had for, you know, 7 or 8 weeks, and I could see them walking down the street now and they wouldn't even know it was me, because they have no idea what we look like. And I think that's probably one of the hardest things, that, you know, you can't, my most of my personality is probably my facial expressions, and people always tell me, you know, my eyes kind of tell people what kind of mood I'm in, and to not see somebody's face and to just see their eyes all the time, it completely changes your nursing. It's really, really difficult. Even, you know, not being able to hug a patient and stuff, it's such a big barrier. And also not having visitors as well. It's just it's everything that goes against nursing, basically. You're barriered against everything. You can't use any kind of emotion. You can't see anyone's face, and it's really, really hard. It's really hard.
It must be a case of, as best you can, just finding other ways to give your patient that comfort. So really the last thing you've got probably is verbally, but I imagine that also takes up a lot of your energy to do that, especially in all of that equipment. But that's all you can do. It probably feels a bit more robotic without, you know, that side of things. That's brilliant. I think you know, just on that topic of COVID, and as I said earlier on, it's not something I wanted to talk about hugely, because I think there's so much out there and there's so much more to nursing than COVID, but it's relevant, it's in our lives now. So, you know, if there was some advice you could give to the public in terms of, you know, what they do that helps them, and in some ways obviously helps the whole nursing profession as well, perhaps, but what's the best thing that people can do given the situation that we're in now with COVID?
I think probably just follow the rules. I know where I live. So I'm in a small village, but a lot of my friends live in the city, which is like 40 minutes away. And even from last year's lockdown, people just didn't follow the rules, like going in and out of houses, putting 3 or 4 people in a car. It's just, people complain that it's not getting any better, but then if you're still walking around, still going in and out of your friends' houses, well, it's not going to end. And it's almost like we said before, learning to live with it rather than saying we're going to get rid of it, because we're probably not. And that's not to put a negative spin on it, but it's reality, isn't it? It's turned into something that's like the flu. It happens every year, and it's just what we're going to have to learn to live with. But yeah, I think just following the rules, just being sensible, and just, you know, looking after yourself and looking after people, you know, looking after other people, and making sure that your well-being is good. You know, find a way, like, you don't be just getting outside every day even. I mean, I know I don't, but you know, or if, because I know it's winter and it's much harder than it was last year. We were really lucky with the weather in lockdown. But even, you know, doing a bit of cooking or a bit of sewing. I know I've taken up cross stitch. I feel like a little old woman in my hair doing my cross stitch. I think it's just, you know, learning to adjust your lifestyle to, you know, to be able to live with COVID, rather than, you know, thinking it's only a few more weeks and then we can go out. And I think that it is really hard when the government, you know, change the rules. And I mean, it does get really confusing. And, you know, especially this area is not far away from me, that I've been in tier 3 and I've been in tier 2, or, you know, but I just think an example is probably over Christmas, when people, you know, had those couple of days, and it was like, how many people can we cram in a house? And then a week later, everyone's got COVID. Well, shocker. But I just think it's about being sensible, really. You know, meeting people outside rather than inviting them around for coffee and stuff. And then it is hard. And, you know, I haven't seen my family for, you know, this is going to be the 2nd year now, but it's just a reality. And you know, just, I don't know, I think just be sensible, look after yourself, look after other people, and stay 2 meters away.
Yeah, and try and get your vitamin D. But yeah, absolutely. I just dropped my pen there. But yeah, that's it. I mean, I encourage people to talk over social media, you know, even doing, you know, I know a lot of people are into sort of messenger type talking, you know, just tapping away on the phone or whatever, but actually just doing a face-to-face talk sometimes with someone's a really nice thing to do. It just feels more real, and it's just like you said, then you get the facial expressions, and it's a bit more like having that person in the room with you, isn't it? And I said on the previous podcast that for me, routine is really important. So, you know, I'm still getting up at 5:30 most mornings, do my usual sort of cycle training, which I do mostly indoors, and or yoga or whatever I'm doing that day. And then I can always find things to do. I'm sort of, you know, doing these podcasts for my channel and stuff like that. I can fill a day, no trouble. You know, I've started a training course, and, you know, just again, it's just plenty of things to do, and then I feel like my day's full, like I've achieved. I could just sit on the sofa and watch TV, and it's not a judgment if someone wants to do that, but for me that would bring me down over time, because I just wouldn't feel I was achieving anything. And I suppose I like to finish a day and go, yeah, that was a worthwhile day. It made a difference, either to somebody else or to me or whatever. So and I think also, you know, just speak up if someone's like in a bad place, whether they're financially, you know, so many people are financially struggling or worried. Then again, just speak to someone, have a chat. because I do think there's always going to be someone who will listen and, you know, will help. No one wants to think that somebody just sat at home in a desperate state and did nothing and didn't speak to anyone because they didn't believe there was anyone they could reach out. You know, there's so many forums out there and places you can link in with people. So I think that's really important. So thank you, Tara. I think, you know, it does give us a great insight into nursing, things that we just wouldn't know. And, you know, this is real life. You're dealing with people and it impacts their lives. And, you know, whenever I hear anyone talk about nurses, it's always good. I cannot think of one, you know, I'm sure there is the occasional bad experience because, again, it's life. But I can't think of one time when I've ever heard anyone say anything bad about a nurse. And I think that's, wow, that's really testament to the profession, to the people in the profession. It's not an easy profession. I couldn't do it, I know that. And it's just hats off to you and to all the nurses out there for everything you do, not just in this time, but, you know, all the time. Because if we didn't have the nurses, we'd be in a whole lot of trouble, you know. So nurses basically keep us going, keep the whole medical profession going. So we need you peeps out there. So keep smiling even under that PPE when you've got it on. And thank you for your time.
No worries, thank you.